think you've done brilliant, you've given her a great start, but I think trying to manage this is going to be very detrimental to your mental health.
The whole food thing is mixed up with emotions. My whole eating thing started because I was really afraid of not being perfect.
My leg seems to be hurting. It's just very tense and swollen and sore.
Okay.
And it's painful to kind of stand on.
The most serious one is whether there's a little blood clot sat in there. Now, I think we should send you down to A&E.
I get the pain here and sometimes in my back.
I would like someone to look at that quite urgently.
My whole system's not functioning correctly. It just feels like I'm a bag of bones and all the nerves on the outside of the body.
There's some things you've said that I don't think we can dismiss.
What on earth's going on?
Hi, Shelley. Hi, come on in. Come and have a seat. Dr. Beecraft. Right, what are we up to?
I came a few weeks ago for something related to work, but when I was here, I mentioned to Dr. Morris that I have been bleeding since my last injection.
Okay.
And she said to me, if it continues, then come back and we might need to do an internal exam.
Sure.
She asked the question at the time whether, do you bleed after sex? And to be honest, over the past 2 weeks, I've actually started really freaking myself out because my boyfriend went away for a week. So when he was away, I didn't have any bleeding at all.
Okay.
And then when he came back, we had sex, and it's just a lot of blood now. It seems to have got a lot more. And then end of last week, I don't know, part of it is psychological because I'm freaking myself out, but it's starting to feel uncomfortable when I'm having sex.
Okay.
So I'm just generally...
There's lots of things. So with your depot, how long have you been on that for?
I've had it on and off over the years, a long time. Whenever I come off it, my periods start up completely regularly, very quickly. In between the injections, I will have a certain number spotting, which is what I thought I was having.
And you were on time for your recent injection?
I don't know where I am.
Don't know with this.
No idea.
Okay. And let's looking back at here. So you had a smear test a couple of years ago and that was completely normal, which was good. And it looks like you were checked for chlamydia and things at that time.
Yeah.
And have you had a new partner since then? So that was April 2013.
Yes. Yeah.
Okay, fine.
Have you seen somebody before, or is this a first appointment?
In you come. Right. So it is a long time, yes.
Yeah, how are you?
I am very well. How are you?
A bit anxious. So I just said to myself, there's no need for that. Because when I go to church and I listen to the word, the good word, there's no need for that, to be anxious.
Yeah.
But, I mean, we're human, aren't we?
Yeah, are you anxious about anything in particular?
Not really. I shouldn't be because my daughter, my son, my grandchildren, my son-in-law, daughter-in-law, they're very, very nice.
Yeah.
So why should I be anxious? And I just talk to myself.
Yeah.
Why should I be? It just, I think, human being.
Yeah.
Sometimes you go through things like that.
Yeah.
But
we all have periods when we feel anxious.
yes,
and that can be normal.
that's it. Yeah.
But if
and that shake it off. Just shake it off.
Yeah. If it depends how big a thing it is for you. Is it affecting your life?
It isn't really. When everybody are around, that's
fine.
It's all gone.
Okay.
Gone with the wind.
Okay, so it's maybe when you're by yourself.
Yeah, then yet you feel a little bit like, oh, I need to. But I keep myself busy. It's not a big problem, really.
Okay.
It's not.
All right. Well, you know, if you wanted somebody to talk to about it, you
Yeah.
could either see we've got psychologists in the surgery here that you could speak to if you wanted to,
Right.
or I can give you some information that you can do at home to try and help with anxiety, or sometimes just speaking to people coming in and talking can help.
That's nice. Yeah, that's nice to hear. On Mondays and Thursdays, like I'm going to go to Tai Chi classes.
Brilliant.
Later on.
Fantastic.
On Mondays, it's a dancing class. So I think all these are helping.
I think,
you know.
Yeah, that's a really good thing to do. Do some exercise, something with other people. It's good fun.
Yeah.
That's a perfect way to try and help the anxiety. Okay. Well, you look really well. You look far younger than your years, I have to say.
Thank you for saying that.
Okay.
Of yourself.
Thank you, and you.
Good morning, Vicky speaking. How can I help?
We don't have any appointments tomorrow.
So, should we examine you first and see what's going on? Are you having bleeding at the moment?
I am. I had a tampon in this morning, but I've taken it out.
Come and lie up on the couch.
Sure.
Slip your bottom half off. So Shelley presented with this irregular vaginal bleeding, and there are lots of things that can cause it. So it was really important to try and establish why she was having it in particular, and going through various different other symptoms that would help us work out what was going on. All right, I'll just get everything open because otherwise I'll be stuck in it. Okay, can I get you to bring your feet up towards your bottom? So I'm going to just pop the speculum in. It's going to feel a bit cold. When Shelley mentioned that she was having bleeding after sex, that was something to be particularly concerned about, because that can be an early sign of cervical cancer. Fine, well done.
You have this in your thing. Are you going to take the temperature?
It was a bit tickly.
Oh dear, that's a very sad cry.
He is crying an awful lot at night time.
Okay, well done. Shall we pop back in here? Okay.
So, oh dear.
William, don't go to the bin, please. Boys, please stop moving that table.
No, it's not for you, please.
That's it.
Room 12. Off you go.
Hi, Juliette, how are you? Hi. In you come, gorgeous. I know we're moving all around at the moment. We're in different rooms every time, aren't we?
Sit there. Do you sit on that one? I'll sit there. Okay, so you can sit on my lap.
I like your dress, Chloe. It's pretty.
Who's your dress from? Oh, Amy.
Oh, lovely. And how's Georgia getting on?
So she's brilliant.
Good.
She's such a good girl.
Juliette came to see me with her eldest daughter, Chloe, who I know well. And she's got a newborn baby at home who is doing really well. But she was worried about breastfeeding.
One of the things I wanted to talk to you about was my milk supply, because I've been having really bad migraines. So I've had to take too many painkillers that I'm comfortable feeding her. So I've been trying to pump, but I haven't been able to enough. But
yeah.
I don't. I'm just a bit worried because I'm ending up having to take the painkillers every day, and I'm veering more on the tramadol because I know that they said that's less of a risk. I'm just a bit worried that, but I know they're addictive, but I'm just, like yesterday, I kind of try to get to the stage where I literally can't even sit, where it's like unbearable before I take it. But
And this is the back pain now?
This has been
The
the
tummy
stomach
pain.
cramps actually, and then of course I get dehydrated and then I get a migraine. So
Juliette suffers with really severe abdominal pains, and the only thing that really gets on top of it is codeine or tramadol, so opiate-based painkillers. So she takes those when she really needs to. Opiates can pass through into breast milk, so ideally we don't want people to be taking strong medications when they're breastfeeding. But she was understandably worried about the effects of this on her new one.
So what I'm doing is, if I'm taking kind of more than 2 or like 3 in a day, then I don't give her any of my milk. But if it's less than that, I'll pump it, but just give her little bits so she's not getting too much of it. Do you see what I mean?
Okay, I'll get the nurse to give you a call back, it's fine.
So the bloods are for PSA? No, don't. Breathe.
So when I look inside, the cervix itself looks completely normal.
Yeah.
Now, when we talk about bleeding after sex, the thing that we're more worried about is something to do with the cervix. That's typically the problem.
Yeah.
So either there's something wrong in terms of changes on the cervix that potentially could lead to something nasty like cervical cancer. But we know we did your smear test 2 years ago and that was completely fine. And when I check it and look today, everything seems fine as well. I've taken a sort of chlamydia because that's the only other thing that we kind of really want to make sure that it wasn't. But when I look and examine, actually it looks like the bleeding's actually coming from inside the womb and probably more related to the hormones and things. And it could just be, for some reason, although it suited you previously, it's now just playing silly games. So I'm not so worried. It was a relief when I examined Shelley that I could reassure her that her symptoms were probably just related to a side effect of her contraception rather than being anything else of worry. So what we'll do is send these off. I'll give you a call and let you know what it shows, if anything, find out how things are going, and then we'll make a plan from there.
Lovely.
All right.
Thank you very much.
Okay, take care, Shelley. Bye.
Lovely, we'll see you Friday morning at 8:10.
I take a painkiller and the pain goes down and then it relaxes a bit, so it then helps.
And the Beverain helps or not?
So again, I hadn't been taking that because I didn't know whether it was safe with her, but I don't know whether it's better to just stop feeding her. It's starting to get quite a struggle. Like
I think for you, okay, and as a result, for you, it's better for her. Now, obviously, best is breast everywhere around the world, and you will feel bad about this, and we will deal with that because you will, and you shouldn't, but you will. You will beat yourself up, whatever. But I think you've done so well to manage this far, Lovey. I'm sorry. You've done so well to manage this far with what you've been through and your chronic pain. You know, you've done amazingly. She's 3.5 months old. It's amazing. A lot of people would have just been like, I can't do this. Don't worry, darling, Mummy's fine. Do you want to look at the toys? They're under here, look. Oh, what's here? Look, Chloe, what's in there? Wow. I think you've done really well, and I wouldn't, you know, obviously, I'm not supposed to say you must stop, you mustn't stop, but I know you now well enough, I think, to say I think you've done brilliantly. I think for you, for all of you, actually, it would be fairer to stop because you're trying to pump and work and take her. And
it's just I can't. Like with her, it was easy because so I could just, and also I seem to have loads more milk. So because I'm running around with her, I can't sit at home all day and be like,
you know, you've got chronic pain issues. You've got another one. You've got a tough time at home at the moment. I think you've done brilliant. You've given her a great start, but I think actually trying to manage this is going to be very judgmental to your mental health if we carry on for much longer. Because trying to juggle it is just exhausting. And actually, what's best for her is that you are a happy mummy. I think Juliette feels terribly guilty about the fact that she's not able to fully breastfeed her new baby girl. It often is heartbreaking, and I really feel, as a mother myself, I feel that pain that Juliette was in. You know, all she wants to do is do the best for her child. What's so important for a healthy, happy baby is a healthy and happy mother, and that mustn't come at the detriment to the mother's health. It isn't breastfeed at all costs. It's breastfeed if you can, and it's wonderful if you can, but if you can't, you have to feed your baby, and that's absolutely fine to do with formula.
What I might do is try and just pump in the morning and in the evening and see how much I can get, because that's easy because she's in bed and then I can do it just when I get up.
Just make your life a bit easier for you.
But not worry too much.
And then if it starts to tickle, it starts to trail off, then it starts to trail off, and maybe it's the natural way of ending. So I would be fair to yourself. I think pumping in the day is pretty torturous at the best of times. When you've got a toddler, I don't know how you're doing it at all. I think it's amazing that you've done it at all. And you might find, OK, I'll do that for a couple of weeks, and then maybe actually it's time to stop.
Yeah.
And that's fine. You've done brilliantly.
Okay.
You know, brilliantly.
Okay, come on then.
All right, gorgeous. Can you pop those back in the box for me? Shall I get you a sticker, miss? Would you like a sticker?
You want a sticker?
I think you deserve a sticker today. You've been a very good girl. There we go. Do you want to take one for Georgia? Should she have a butterfly?
Should we give her a butterfly?
There.
Say thank you.
It's a pleasure.
Thank you.
Nice to see you. Bye. Oh, my careful with your feet backwards, sweetheart.
Say bye, Dr. Taylor.
Bye-bye, Dr. Taylor.
Bye-bye, darling. Bye. See you soon.
Okay, what I'll
I'll do then is just get the doctor to call you today, the duty doctor, and they can speak to you over the phone.
Do you prefer morning or afternoon?
Wait for them to call and they can make an appointment for you. They can squeeze you in.
Andrew Taylor. Come through.
No, I know the story of swing child. I wouldn't be that surprised.
No. Have a seat.
Well, it just needs all the money.
Yeah. How are you?
I'm all right, thank you. I think I'm just checking in with you about various things. So from the top, or from the bottom, I suppose, prostates. And last time I saw you, you're going to do some blood tests.
Let's have a look. So we were talking about the fact that you'd been going more often, a bit more urgent to go as well.
Yeah.
So those bloods were all really healthy. You know, we'd assessed your prostate by examining you, and we did the other part of that assessment, which was the prostate blood test, which was completely normal.
Fine.
So
Okay.
really, really healthy.
Fine. Okay, that's the blood test one. Osteoporosis. I went for a bone scan down St George's.
Osteoporosis report. So indications, the fact that you've been on the steroids, we know you've got colitis. They looked at your bone density in two places. In your spine, you do have osteoporosis. At your hip, the bones are thinner, what we call osteopenic, but not yet progressed osteoporosis. But the conclusion of this is that you do have osteoporosis, and that does put you at risk of broken bones. So I suppose that you are quite young for us to have made that diagnosis. You have two clear risk factors, the colitis and the fact that you've been on the steroids. What dose of steroids are you taking now?
I'm now down to 2 a day and just about to go down to 1 a day.
Whenever patients are prescribed medicines, it's a question of balancing the potential benefit against the risks associated with that treatment. And in Andy's case, with severe ulcerative colitis, he had a lot to gain in controlling that condition using steroids. I think it is very likely that that steroid use has contributed to the development of osteoporosis. So what I would like to do is probably do another set of blood tests. They suggest we check your testosterone levels as well, given your the fact that you're quite...
Feminine?
No, sorry. You're quite young to have osteoporosis. So we should check your testosterone, check your vitamin D again, and consider treatment with another medicine for osteoporosis, which is a weekly treatment. It tries to build up your bones again. In your bones, they're always being broken down and rebuilt all the time. Right. It's like this cycle. And it stops the breakdown of bones. So they, in theory, we let your body build them up a bit. It's very difficult for us to accurately predict what the future might hold for people. But we do know that osteoporosis confers a higher risk of broken bones. However, we have a great opportunity with Andy to work with him over the coming months and years to make sure that we've pursued all the avenues available to us to make sure that his bone density is as good as possible and to reduce the risk as much as is possible.
Great.
Nice to see you again. Take care. Thank you.
Thank you.
I'm not clinically trained, so I wouldn't know, I'm afraid.
Oh yeah, that's nice, the pressure.
Hi, is it
Hello.
Kevin?
Yes.
Hi, I'm Dr.
Hi.
Watson. Hi.
Oh, hi.
Nice to meet you. And you come and have a seat.
Right.
So we spoke on the phone earlier in the week.
Yes.
Yes. Okay. So you mentioned a couple of things on the phone. You said you were quite worried, particularly about headaches and about your weight.
Yeah. Well, the nausea and the headaches and just a general feeling of something wrong here. But and also to try and get the results from the CT scan that
Yeah,
you couldn't
I
find.
have got that now. It has come
Okay.
through. Okay. So just so I can clarify for myself, so it's headaches, nausea, and weight loss, and you feel that something's not right.
Yes. The whole my whole system's not functioning correctly. Like it affects my tolerance with conversations with people, and I just have to pull away and I can't concentrate. And
Okay.
I'm not eating properly. That's really because of the nausea. I just don't want to eat, but I need to eat, but I don't fancy it because it makes me feel worse. And
Just to clarify, so the headache you're getting, is it there every day, or how frequently are you getting it?
The weird thing is, it's there 75-80% of the time.
Okay.
So it's just a circle of what on earth's going on.
Okay.
How much about the knee do you know?
I'll be honest, mostly from hearing about professional footballers getting injured.
Absolutely.
Unfortunately, ankles are not the easiest thing to rest. Once it heals, you should be able to get back to your running.
When I bend it like pops.
And if you move your foot up or down, does that make a difference at all? No, I don't think so. Strange.
Andrew.
Hello
yeah,
there.
hi, come
Hello.
on in. Sorry, I'm the furthest from away. Come and have a seat.
Okay, thanks a lot.
Right, how can I help?
Well, for reasons that I don't quite understand, my leg seems to be hurting. It's been hurting since kind of Tuesday evening.
Okay.
To be honest, I was hoping it would go away.
Mhm.
It's just very tense and swollen and sore.
Okay.
And it's painful to kind of stand on and walk, and also, even when you're not doing anything, just
Mhm.
lying down or something like that. I've been trying to rest it
Okay.
a bit. And sometimes it starts kind of in my bottom.
Okay.
And sometimes down here. It's tender, particularly around here, and it feels tighter.
Yeah. Any long flights or long journeys where you've been sat down for a long
Well,
time?
I travel an awful lot, and I fly quite a lot, but to be honest, for the last month or so, I've only really been taking the Eurostar 2 or 3
Okay.
times a week, which is only 2 hours.
Fine. And so just sat there at the moment, is it tender?
Yeah, I can feel almost a twitch just starting to happen here,
there.
actually. Yeah.
Okay. And it's just in the calf here, not anywhere.
It's kind of all the way down.
But just as you are, I just want to
Yeah.
have a little feel. So this
Yeah.
is the good side.
Yeah.
Okay. That's all.
Yeah, it is, yeah. Yeah, it's definitely sore.
Yeah, sorry. Okay.
I didn't think it looked radically different, actually.
You didn't?
No, I didn't.
This one is-
in terms
yeah.
of size.
So this one actually is
Okay.
a few centimetres bigger. So it's a bit odd.
Yeah.
It's definitely swollen on that side.
Yeah.
And it's clearly very sore for you.
Yeah.
And so there's kind of things that we could think of
Yeah.
that would you
Yeah.
need to exclude.
Yeah.
The most serious one is whether there's a little blood clot
Yeah.
sat in there. Now,
Yeah.
it would be odd because, yes, you've been doing lots of travelling, but actually for not really long journeys.
This is the least travelling I've done actually for quite a long
Okay,
time.
so it makes it kind of less likely,
Yeah.
and you don't have other factors that would make you particularly at higher risk for it. But I think that's what we're going to need to exclude. The other option is whether actually you've just got a tear in one of the muscles
Yeah.
of the calf, which is why it's sore particularly.
Yeah.
So I think we should.
Hmm.
I'm afraid the only way of doing it is sending you down to A&E. But I'll give you a letter
Yeah.
and explain why you're here, and then they can assess you, do some tests, and kind of take it from there.
Okay. Yeah.
So if you go down to A&E now,
Yeah.
take that with you,
Yeah.
and then that will hopefully speed things up a little bit for you.
Okay.
All right, okay, we get it sorted.
Okay, thanks a lot.
Okay.
Thank you.
Bye.
Bye.
There's nothing bad that's come up in your results.
Mhm.
There's a couple of minor things. We talked on the phone about the iron being a little bit low, and you're slightly anemic. So
Yeah.
your haemoglobin here is 117. We'd recommend that you take some iron to try and replace the fact that you're quite low and try and treat the anemia.
Mhm.
And then we do need to repeat the test so we can check things are improving with the
Right.
iron. The scan result, I just want to get up as well. So I gather there was some concern because your father had a history of a cerebral hemorrhage, and there's
Well,
nothing
my
like.
father died of a brain hemorrhage, yeah. And I just thought it was worth mentioning.
Yeah,
obviously.
absolutely.
Uh,
So there's nothing sinister or bad that's come up on the scan. Essentially, it's normal, but whenever we do tests, very often we come up with little minor things. So
Right.
what they have commented on, mild textural irregularity around certain areas of the brain. That essentially what they're saying is it's possible to have very small old strokes. I suggest what we do is maybe speak to the radiologist and try and get that clarified.
Just feel as I'm a bag of bones and
okay.
all the nerves on the outside of the body and hypersensitive to everything and physically, and then that makes you feel the same mentally.
Yeah, no, that makes sense. Can I clarify about your weight and how much you've lost? Because I don't have any previous measurements.
10.5 sort of max is what I've sort of ever been.
Okay, so you've lost almost a stone.
Right.
With that, because this is coming up as 9 stone 4.
Yeah.
Over what sort of time period do you think you've lost that weight? How long have you been concerned about your weight?
Again, 3 or 4 months, sort of goes in line with the rest of the stuff in a way.
Okay. There's some things you've said that are slightly, I don't think we can dismiss. And one, if you've lost a stone of weight, you're not feeling yourself, you've got this nausea, this lack of appetite, and we've picked up this low iron and this anemia. Sometimes it can mean something like a little bit of bleeding, a bleeding point, sometimes in the gut, and that can be for various reasons, and it might not be that. Don't go away panicking. I just want to get it all checked to make sure, because you obviously feel yourself something's not right.
Yeah. Okay. Really appreciate your time.
That's fine.
Thanks for
That's
seeing
no problem
me.
at all. Okay. Well, I'll go and speak to Dr. Beecraft after clinic and just feed back to her what you said to me today.
Okay.
Because we need someone to follow you up and make sure that we're getting to the bottom of everything.
Right.
All right.
Excellent.
Okay.
Thank you
take care.
very much.
You're welcome. Okay.
All right.
Bye.
Just want to make sure she's in before I make your promises.
I can get doctors to give you a call back.
So Lisa O'Sullivan, hi, come in. Come take a seat. How can I help?
Right, my foot. I'm getting real bad. I've rung up about the doctors before and they put me on painkillers.
Okay, so what are your symptoms at the moment?
It's just going from here, it's getting numb. And it's going right the way down to my leg now.
Okay. And are you getting any pins and needles or numbness?
I'm getting numbness.
Yeah, and is that down the outside
it's getting,
as well? Yeah. Okay. And is it above and below the knee there?
It's going all the way down? Like, it's kind of, it goes from this place and across my back here, and then it'll go to the bottom of my leg. It's not usually the whole thing, but it's getting so hard to get to places.
Okay. Does your leg feel weak at all?
It feels, it's really weird. It feels like as if it goes like a rock.
Yeah.
If you know.
Okay. And are you peeing okay, opening your bowels as per normal?
You see, I'm getting a pain down here when I'm trying to go to the toilet.
Where, sorry?
Just at the bottom, like here.
Okay. All right. I probably ought to just examine you if that's okay. So when you're ready, come and take a seat up on the couch. Okay. So this is cotton wool, so it should feel nice and soft. Yeah? That feel okay? So I'm just going to check both sides. I want you to tell me if it feels the same on both sides. Can you feel me touching you there?
Yeah.
Yeah. Does it feel the same?
It doesn't feel the same. This one's more sensitive, I'd say.
Oh, really?
Yeah.
The only other thing I need to do, I just need to examine around the back passage, if that's okay, just to see if you can feel the sharp and the cotton wool around there. Is that all right? Yeah. We just pull the curtain. Okay, so it's a bit odd. The reason is it sort of has different meaning. I'm trying to work out which nerves are involved. Okay. And the nerves right at the bottom of the back are the ones that feed around there. Right. So just got cotton wool here, first of all. So I want you to tell me if you can feel it, that's all. So, can you feel that?
I can't feel it on the other side as much.
So which side?
Can't feel it
on there. And now this one is a little bit sharp. I'm going to just very lightly touch you. Can you feel that?
Yeah.
And then on the other side. Feel that?
No, not as much.
It's very common for people with back pain to get numbness or altered sensation in their legs. And it's usually caused by something irritating or pressing on the nerve roots as they leave the spinal cord.
Okay, so you're on quite a lot of painkillers. And there is a little bit of loss of sensation around the back passage, actually. So I think what I'd quite like to do is I just want to kind of phone one of the surgeons at St George's and just see if they want to see you today, if that's all right.
Okay, yeah.
When Lisa said that she couldn't feel me touching her with the cotton wool around her back passage, that can indicate something much more serious called cauda equina syndrome. Cauda equina syndrome is caused by something, usually a slit disc, that presses on the nerve roots inside the spinal canal before they've left the spine. So it can cause much more extensive damage. And if left untreated, the patient can end up having permanent loss of sensation in the legs, loss of function, and doubly incontinent.
If you keep your mobile handy, if I can get through to them now, I'll try now, and then I'll give you a ring as soon as I've spoken to them, and they might want you to go down there.
What do you think it could be then?
Well, I'm just wondering whether there's something pressing on one of the nerves there, and that's what's causing so much pain going down the side there. You all right?
Okay, thank you very much.
That's okay. All right, so
Okay,
I will be in
well,
touch as soon as I've heard from St George's. I'll give you a ring, okay?
Thank you very much.
All right then, pleasure. Bye-bye.
Bye.
On the day that I saw Lisa, I attempted to contact the neurosurgical team. Unfortunately, there was no answer, so I sent Lisa to A&E because she needed to be seen and assessed urgently that same day. When she got to A&E, she did have an MRI scan, which confirmed my clinical suspicions. She did have cauda equina syndrome, and then she had the operation before she suffered permanent neurological damage.
And you said you got abdominal pains for the past 3 days?
Sorry, sir, I have a few things I need to ask you about. Okay, no, that's fine. Yeah, that's absolutely fine, of course. Okay, can I ask how things are going? I know what you saw Dr. Morris about your weight and things.
Yeah.
How are things
ask,
going?
would it be possible to weigh myself?
Of course, let's do
Do you have the
that.
same scales?
Yeah, let's do. So the scale's just around here. If you can pop on there. Okay, so your previous one was 54, so that's good. Just up 1.5 kilos.
Okay.
Which is good. So your BMI is 18, and we should be aiming for a BMI of 19 or 20. So I think as a sort of target weight, you're probably ideally looking for about another at least 4 kilos. In general practice, we are seeing an increase in people with eating disorders. The average age of presentation of an eating disorder is around 16, 17 years. And the majority of people with eating disorders are young girls or women. People with eating disorders often find it difficult to speak up and ask for help. The first step in getting better is recognising there is a problem and talking openly about it to get the help that you need. How are things going?
Yeah, it's actually interesting because that's what why I started that banner that I was telling you about. Was wanting to, because I think the whole food thing is a lot mixed up with emotions and stuff, and it's not just the food issue, it's a lot more than that.
Yeah.
So it's been really helpful just been getting counselling and actually been addressing like other like roots of why my eating might have been bad.
Okay, that sounds really
that's helped.
Helpful, yeah. And that's
really
the
helped.
banner that you've got. Do you want to show me?
Do you want to show me?
Yeah, absolutely.
Because I broke my foot 3 days after I started it.
Jessica has made fantastic progress and is doing currently very well. She broke her foot several months ago, and she found that when she was wearing crutches and she was forced to have a period of rest in hospital, that she was able to openly accept the help from those around her. And it made her draw comparisons with her emotional well-being and with her anorexia.
Okay. And I called it the Beauty from Ashes journey because I guess like my whole eating thing started because I was really afraid of not being perfect and wanted to like address why I didn't feel like good enough or perfect as I was. So I started the banner as a friend gave me the phrase, "When I'm me, I have liberty."
That's a very good phrase.
Which was a really good phrase.
The beautiful poster that she showed us in the consultation was her way of illustrating the healing process that she went through. I was very touched that she wanted to share that with me, and I think it's an excellent way that she has found for herself to help describe what she has been feeling. You mentioned something about some counselling that you're getting, did you say? Just like dealing with why maybe I felt like why I felt I needed to turn to food to control things and actually find my safety in a new place than controlling food. Great. Well, it sounds really positive. And you're still seeing the counsellor as well? Yeah. Yes. Okay. Is that every week? Or it's been close to, yeah. So maybe just if we could see you maybe in 4 to 6 weeks, see you in August and just check things are still, because it sounds really positive. Yeah. All right. Thanks so much. Well done.
Takes
Very
courage.
Inspiring.
Takes courage.
Yeah, it does.
It really does. It's life transforming.
Thank you. No, you've done all the impressive hard work, but do come back just so we can check everything's still so good.
Miss Cecilia, how are you? Take a seat. How are you this morning?
I'm okay, but it's my stomach. After after hour and a quarter, I get the pain here and sometimes in my back. But
that's after eating?
Yeah, after, not straight away. After 1 hour and a quarter, that happened.
Because I know you have had problems with heartburn in the past, haven't you?
Yeah, but it's not the heartburn this time, doctor. It's pain. It's a pain here, and sometimes it goes at the back.
Yes, because this has been going on for how long now?
Last 4 weeks, that pain.
But it had been going on
before,
and then it settled.
Yeah, but it wasn't exactly the same pain. This one is different.
So do you have nausea?
No, just pain.
Just pain, and there's no vomiting?
No.
Yes, okay.
No vomiting.
And have you lost any weight?
I lost weight.
You've lost weight?
But I don't eat
But is
as
that
much.
because you're trying to lose weight, or?
No, I didn't try. Just I lost about 6 kilos of weight.
When was that?
Oh, but I started to lose weight about 5 months ago. People said, "Oh, you're losing weight," and funny enough, I weighed myself this week. But I don't eat as much when I eat.
So
I feel full up quick.
You feel full?
Yeah.
Full. Let me examine your tummy. Okay, pop yourself on there. Claudine's unintentional weight loss did concern me. Unintentional weight loss or unexplained weight loss is one of the non-specific signs of cancer. So where's the pain you're experiencing?
I can feel it. Yeah.
Yes. You've got no pain down here in the pelvis? No. Let me have a look.
That's where
it's tender.
That's where it is, really.
Okay.
Have a seat, my dear. Oh, how nice. I get all the best presents.
No more than you deserve.
Oh, cheek. I think we need to start this again.
You're not going to like this word. It's an ageing spot.
Oh, I see.
So breathe in through your nose and out through your mouth.
My knee's sick, my back's sick, and now this down the...
Are the bowels working well?
Really working what?
Are you going for a poo okay?
Get yourself dressed and come along here. So with the weight loss, because 5 kilos is quite a bit, isn't it?
It is, yeah.
And you think your appetite is less?
Even when I put some food in my mouth after a while, I don't eat as I used to be, I'll be fair, honestly.
Yes. So I think, well, we're going to do 2 things. I'm going to do some blood tests. But because you seem to have lost quite a lot of weight, I think we need to look at that, why that's happening, because it's not that you're trying to lose weight, it's nearly a stone. So I would like someone to look at that quite urgently.
Yeah.
So I'm going to refer you to hospital. So it's under this referral pathway called the 2-week rule. Referring someone on the 2-week rule referral pathway causes sometimes significant anxiety. And that's why it's important to explain the referral pathway in detail to patients. So this is, designed to see patients quickly when we think that there might be a cause for concern, something sinister, a cancer, for instance.
Yeah.
I think it's important to try and get the message through clearly. So I always make sure I use the word sinister followed by cancer. It's important that the patient hear the word cancer during the consultation. I'd like to stress that over 70% of the 2-week rule referrals we do, and patients end up being reassured.
It passed my mind. I said, one day have I got cancer?
I'm not saying that you have, but I think it's important to exclude that as a possibility.
But it came to my mind that, funny enough.
The 2-week rule referral pathway was brought in with the intention to improve our cancer survival rates. It is very important that patients attend their appointments because there are many people behind the scenes trying to offer the patients an urgent appointment, and patients need to be aware of that.
Here we are, Mrs. Celia. So someone will call you from St George's Hospital to give you an appointment within the next 2 weeks.
Thank you very much.
All right.
Thank you, doctor.
Okay, so we'll be in touch.
Yes.
All right,
Bye-bye.
Mrs.
Have a
Celia.
good day.
Bye-bye.
Thank you.
Okay, I'll get the nurse to give you a call back, it's fine.
No, he's not back until Thursday.
Yeah, we've got a specific clinic for the 8-week checks.
Oh my goodness, about to stab me.
I'm looking forward to hearing how work is.
Yeah. Well, do like a return to work farm.
Anything, yes.
And him say where I want to work. I say, you know what? Where I'm comfortable.
Barbara comes in from time to time. It's nice to see her. Last time I'd seen her, she had been suffering from stress and I'd signed her off for a couple of weeks. So work is messing around?
Yes, they're not good. All them doing to me is mess with me.
How can we go forward with this?
I want 6 months off.
Maybe you need that. She worries a lot about certain symptoms, signs, things that she has, because in the past she has had a brain hemorrhage. How are you?
When I wake in the morning, I can't see. I use this one, but I have another one I buy as well. I buy both of them.
Yeah.
But them don't work.
Okay.
My eyes still itch. Itch hurt me. I used to have this thing when I was younger, you know.
Yeah.
Them call it pink eye.
Pink eye.
Back home.
Yeah. So just look up at the ceiling and to your left and to your right and then down. Yeah, it's okay at the moment. It's hay fever, it's allergy. The one that you can use is called promoglycate. You had it as a prescription 2 years ago.
2 years ago?
So it's a hay fever related thing.
Oh, I don't know.
So it comes at the same time for you every year.
Oh.
It will get better, but the drops just reduce the itching.
Dr. Shah, I have a big problem with my leg, where this thing keep coming. I got to church the other night, and I feel happy, and I was jumping. Feel something run up in my leg, like seriously hurt me.
Yeah, sounds bad.
Really bad.
Yeah. Muscle spasm, muscle contraction comes
in my leg.
What you need to do is to stretch that muscle.
Oh.
Okay, which is hard to do because you have to work out which muscle. So let's say it's a muscle here, then the way you stretch it is you stretch it this way, out. That's stretching it. All right.
Thank you very much.
Okay.
Great, okay, that's fine. Let you go and enjoy the rest of the evening.
Book in again in about 6 months or so. Okay.
All right.
Thank you very much.
Lovely, Rebecca. Bye. Pop that into reception and we'll take it from there. Okay, nice to see you.
Thank you very much.
Pleasure. Yeah, nice to see you too.
And I presume I'll see you again in March.
Yes.